welcome to Mal and Tad YouTube channel, and I have posted another skills video. Check it out and let me know if you guys have any question. Hello, my name is Mahalit, and today I will be teaching a post-op teaching for a post-op patient. First thing I'll do is perform hand hygiene and introduce myself to the patient. And after that, I'm gonna go ahead and instruct my patient to and demonstrate to do the diaphragmatic breathing. This allows the patient to use their lungs 100% capacity to increase the lung efficiency. And patients should practice this breathing exercise this breathing 5 to 10 minutes at a time, and 3 to 4 times each day. And I'm gonna go ahead and show you how I'll instruct this to the patient. So the first thing we do is we inhale through the nose, exhale through the lips. So this is how we're doing, and we have to make sure to tell the patient to hold it up to 2 seconds. Then make sure the abdomen rises and engaging with the core. The next one to teach is that it's about the incentive spirometry. So this is a very effective lung exercise to help the lungs recover after surgery or illness. So the normal lung capacity is about 6 liters, and this one has to be used 1 to 2 hours. And the incentive spirometry is recommended for a patient with COPD as well. And if you score 80% or more is the predicted value, and it measures the volume of your breath. So the goal is that to position the yellow indicator we see here on the left side of the spirometer is to show your best effort. That's the goal, to use the indicator as a goal to work forward during each slow deep breath you're taking. After each 10 deep breaths, you have to make sure you cough just to make sure the lung is clear. So this, as you can see, the incentive spirometer is a handheld device that will help people to take a slow and deep breath. So will allow you to help you breathe, allows the air to inflate, giving a chance your lungs to open airway and prevent fluid or mucus buildup. So how you do it is we're gonna sit up and hold the device, and make sure you place this mouthpiece. Make sure you place this mouthpiece in your mouth. Make sure you seal everything over the mouth. Nothing is coming out. And then we're gonna breathe out, exhale normally, inhale slowly, and this can be used differently for different height, sex, and age. And when we inhale, we make sure we hold it for 6 seconds before releasing. Exhale, and now we're gonna inhale. And that's how we use the spirometer. And now I'm going to be teaching you how to do the half coughing technique. This also will help us to clear the airway. So for the half cough technique, we're going to sit up straight with the chin tilted, slide up, mouth open, and take a slow deep breath to the lungs 3 2/4 full. So, and then after that, we're going to hold the breath for 2 or 3 seconds. Exhale, make sure you exhale forcefully, but slowly and continuous exhalation to move the mucus help like the smaller or larger ways. And we're going to repeat this and follow with one strong cough to clear the mucus from the large airways. So what we're going to do is we're gonna end up we're gonna inhale so what we're gonna do is we're gonna put one hand on the chest, one hand on the abdomen tilted high, Chin tilted high a little, and inhale. So one strong cough while exhaling. So, and then when you exhale, make sure you exhale forcefully. One large exhale. One large cough while exhaling. Another one is controlled cough technique. For this one, what we have to do is we're gonna sit at the edge of the bed. We're gonna sit at the edge of the bed. Make sure your feet is on the floor, and we're gonna put our feet on the floor. We're gonna lean forward a little and relax, and we're gonna breathe slowly through the nose and fold our arms under our belly. And as we exhale, we lean forward and we cough 2 or 3 times. Okay, so make sure you cough two or three times as you exhale with your mouth slightly open. This is not part of it. I'm sorry, I have to cough. So make sure your feet is on the floor. Arms under your arms has to be over your belly, and we're gonna when we exhale, we have to lean forward, right? So we're gonna go ahead and inhale slowly. You're gonna breathe in slowly. And that's how we do the controlled coughing. And now we're going to talk about turning patients in bed. So it's always important to turn patients, because if they're lying in bed after surgery, or if the patient is bedridden, so we don't want any skin damage or skin tissue, because as the skin like friction can cause a skin irritation, so we don't want that to happen. So we always want to make sure that the patient is turned every 2 hours, and if they're after surgery, we make sure of like to keep the, let's say, a hip fracture, to make the alignment to get like the legs straight, don't cross the legs, and we always have to be careful with that. For a stroke patient, to make sure to lift the head, elevate the head of the bed, and always it's very important to reposition patient every 2 hours. So another thing is to do leg exercise for a post-op patient. We're gonna place the patient supine or any semi-fall position, just to give a patient comfort. That's the rationale behind it. And what we're gonna do is we're gonna instruct the patient to bend the knee and raise the foot in the air, and to hold it 2 to 3 seconds. So hold the position for 2-3. We're gonna tell them to hold it for 2-3 seconds. And another the rationale behind this is that to circulate blood from lower extremities back to the body. And another one is to extend the leg into the lower to bed, and to repeat the position to the other leg. Always make sure you do both the legs, and complete do 5 to 10 times each hour when the patient is awake. And also this will promote extends like muscle and circulates blood from lower extremities to the upper body. And another one is to instruct the patient to extend the toes, plantar flexion toward the bottom of the bed, and dorsiflexion toward the head of the bed. And we're gonna repeat this 5 times each hour when the patient is awake. And also to promote circulation, that's very important. So to be consistent for both lower extremities. Just don't do it one and then leave the other one. Do it for both. It will ensure a consistent and optimal blood circulation to the lower extremities. And another one too is to instruct the patient to extend and flex the foot. And to repeat this, doing it 5 times each hour the patient is awake. So so you have to extend and flex for the foot. And again, the rationale is to optimize circulation for the lower extremities. And also another one is to instruct the patient to make circles with the ankle moving first to the left and then to the right, and then do repeat the motion to the circular motion exercise, and we're gonna have to do it for both ankles. So left, right, and you're gonna repeat that for another ankle, and do it 5 times each hour while awaking. And also this is to promote patients' optimal blood circulation to the foot, to ensure consistent optimal blood circulation to the lower extremities. And the other thing to do is for the leg exercise, if we ever used glove to assist the patient, it's important to remove the glove and wash hands. This is because to prevent any transmission of any infectious microorganisms. So it's very important to wash our hand right after we do that, and always make sure if you're wearing a glove, you take off the glove and perform hand hygiene, and always to make sure you provide patients privacy as well. And another thing is to always give a chance for the patient to ask questions while you're teaching, because it's very important to do and give them a chance to ask questions for your patients, and also provide privacy, and also to document how tolerant they were when you were doing all this teaching and when you demonstrate after they did demonstrate. That's one thing to write in the documentation, but you always have to make sure after your post-op education document, and make sure to document how your patient was able to handle it as well. And that's it for today. Thank you for watching. I hope you guys find this very helpful, and also, as always, if you have any questions, ask away and I will be so happy to help. Okay, bye, stay safe.